Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne. Each week, we bring you board-certified veterinary guidance to help your flock thrive. Let's head to the coop. Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne, and today we're back at Nava Farms with Amory and her turkeys that have pox. Actually, appears to be a combination of things going on. So if you remember back several episodes ago, we were out here at Nava Farms again. It was, when was that? Like earlier in the spring?
It was still cold. It was the last cold day.
So we were looking at respiratory disease, and we actually ran some tests, and we confirmed that in this flock that she had Mycoplasma. And so since then, Amory's got some turkeys added to the flock, and turkeys actually are significantly more susceptible to Mycoplasma, especially Mycoplasma gallisepticum, or MG. And so what we're seeing here in her turkey hen, we think, is really the result of Mycoplasma. So you see the swollen sinuses, basically that space around her, under her eye is pretty swollen, and she has the classic bubbles in the eye's watering. But in addition to that, you can see the pox lesions that she has on her snood and wattles and they go over the course of the head. So it's springtime and we've got mosquitoes and it's been raining. We've had probably 6 or 8 inches of rain over the last couple of weeks. And so everything's green, but there's also plenty of mosquitoes. And remember, mosquitoes are the vector for fowl pox, and obviously they're exposed. And so that's really what's causing this to circulate amongst the flock. This turkey's not the only one that has it. There's several chickens here that have it as well too. And we discussed some of the vaccines that are available. Specifically, there's one that we used in a previous episode that protects against not only pox, because it's a pox virus, but it actually has a protein for LT, which is infectious laryngotracheitis. And that is a significant respiratory disease, so we can protect against that one. And then also AE, or avian encephalomyelitis virus. So if you're hatching eggs and you want to protect your flock from AE, that one vaccine will protect against all 3 of these.
Of course I do.
It's a simple one. We've showed it. We'll cite it in the video here, but it's essentially a wing web stab where we give a controlled dose of that recombinant pox into the wing web, and really provides lifelong protection to these birds. So we can definitely do something about the pox in terms of preventing it with vaccination. Yeah. MG is one that, it's a known. We have it here in the flock, and so we deal with it as things come up. So in her case, probably antibiotics would be warranted. Sometimes they get over it, sometimes they need help. Again, when we treat a flock like this, so Amory has a number of birds, quite a few, so it just becomes harder because there's multiple waterers and obviously multiple species. So when it comes to treating any disease, really, whether that be Mycoplasma in this case, or if we're talking about worms, we're really treating at the flock level. It's population medicine, and we want to reduce the burden or the challenge of Mycoplasma, or again, whatever it may be, across the whole flock. And so we treat everybody here.
Yeah. That doesn't build up resistance in the birds that aren't showing signs of it, or?
Well, anytime we treat, we have the potential to develop resistance, right? So that's why we want to do what we call use it judiciously. That's when veterinarians like myself get in and say, okay, hey, this is an opportunity we need to treat. And we pick a drug, or an antibiotic in this case, that Mycoplasma will respond to, because not all bacteria are susceptible to all antibiotics, right? So we target whatever the issue is with a specific antibiotic. In the case of the fowl pox, it's really supportive care. In the case of this turkey, it's actually not too bad. We've seen much severe cases where the eye becomes involved, or at least the tissue around the eye can become involved. But these lesions, I would say, are relatively mild, but I think kind of early too. We're starting to see it go through the flock.
This one has been for a few days now. I thought it was a male developing when his face was red. I was like, oh, a boy. And as it progressed, I'm like, no.
Yeah. So it could be that some of these scabs have actually starting to come off. So it's actually, you're right, it's on the back side of the disease where they're starting to heal. And typically these regress, they'll go away. Honestly, would never know that they were there after she or he gets over it. And we also talked too about, there is vaccination that's preventative, but once your birds have been infected, it's essentially they're protected for life, right? So they'll develop antibodies to this, and in most cases, not to say that it can't happen, but in most cases they're going to be protected for life.
So what about the birds that don't catch it? Do I need to vaccinate them?
Ideally, yeah, we would vaccinate to protect those other birds. And pox is one, like in the face of an outbreak, you can actually get in front of it and vaccinate those that haven't been affected yet. And since you've got so many, obviously it hasn't gone through the entire flock yet. So this would be an opportunity to vaccinate those birds. With vaccines, whether we're talking about viral vaccines or bacterial vaccines, we really break those into two classes, be live vaccines and killed vaccines. So we have attenuated live, which means at one point it was a field virus or field bacteria, field challenge, and then it's been attenuated. So that means it's been weakened, it doesn't cause disease anymore. And then basically it's been adapted to be a vaccine. So it still provides protection, but either causes very limited or no actual disease. And then there are killed vaccines, which we take that bacteria or virus and inactivate it. And then it's mixed with an adjuvant like mineral oil, for example, would be one where that stimulates the immune system to react with whatever the antigen was that was in that vaccine or bacteria or virus. So the killed vaccines have to be injected. Usually they're IM injections. Typically the breast is where we give those most often. They are reactive, so if you're gonna be like consuming your birds, like processing them, that may be one to stay away from. You can still process birds that have it. Just be aware, sometimes they cause like a little granuloma where the vaccine was given. And then there's definitely a withdrawal time, so you want several weeks after. Follow the label, whatever, if you are giving one of those vaccines, to make sure you follow the withdrawal time.
And the dosage.
And the dose, yeah. So usually with poultry, it's a single dose, no matter the size. And with those killed vaccines, we give them between 10 and 12 weeks. We usually give 2 of those, so 10 and 12, and again, before they go into egg production, so around 18 to 20 weeks. So we also have...
Oh, this little baby.
So we've got one other bird we're gonna look at here, and I really wanted to show you because while this chick, she's probably 5 or 6 weeks old, has mycoplasma, it sounds like. She's got a snick and eyes are kind of closed, watery. She comes from a mycoplasma flock, so we're thinking it's likely mycoplasma, but she has a very classic look of what we see in chicks that are having a challenge with coccidiosis. So she's fluffed up, her head is tucked in, she just doesn't feel well. We haven't confirmed it, we haven't run a fecal, but to give you an idea what cocci can look like, although mycoplasma could look like this too, this is a kind of a classic. At the age that she's at and the way that she looks, I would be suspicious of coccidiosis. So if I saw a bird like this in the flock, I'd want to run a fecal exam. We're going to look for the coccidiosis in the droppings, and assuming we find those, small numbers are fine. So like if you have a vet run a fecal and they find, like say 1 or 2, maybe 3 oocysts per field, so when you look at a microscope, you look in one spot, that's a field, and you can move it around. And so if you're seeing 1 or 2 per field, I'm not concerned at all about that. That's what I would call normal.
Right, especially because she was vaccinated.
We think she was. So 1 to 2 per field, normal. If I'm finding 20, 50, 100, or what we call TNTC, too numerous to count, that's definitely a sign that there is an issue going on, and she would need an anticoccidial drug like Corid would help. But in her case,
Oh, little snot bubble.
this is more likely a mycoplasma issue than a coccidio. She's just watching her shake, and she just had that snick where we saw the
Snot bubble.
little snot bubble, yeah. We'll get her feeling better too. So there is an antibiotic that can treat both bacterial infections and coccidia. I rarely use it, I especially don't like to use it in laying hens because it's a sulfa drug, so trimethoprim sulfa, there's variations of it. But that particular antibiotic does have an effect on cocci, so it's an anticoccidial, and obviously it's an antibiotic too, so that's one in this case where we could kind of kill 2 birds with 1 stone, kind of, no pun intended. Thanks for joining us again on this episode back at Nava Farms, and thank you, Amory, for having us back out. So if you ever find yourself east of Austin, stop by here. They just harvested like 3,000 peach trees worth of fruit, right? And so you've got
Mastermanos, yeah.
preserves and all that stuff that you can purchase out here on the weekends when you open?
From 9 to 4, Saturday and Sunday.
There you go. So if you stop by, awesome place.
Lots of produce.
Produce and obviously eggs to buy. So thanks for showing us the flock, especially the turkey. We don't get to see a lot of turkey, so that was fun to see. Maybe next time. I'm not wishing any bad things on your ducks, but there's some ducks out here too that would be fun to take a look at. Thanks for joining us. I'm Dr. Blayne Muzzleshack. This is the Poultry Doc Podcast, and we'll see you next time.